This is the stool analysis by Diagnostechs company, the stool analysis for gut infections. So here's our requisition form, and we'll have all this filled out. Wherever you see a highlight marker, you have to pay attention to that. The sample was collected on, you have to write the date in. The samples were shipped on, you have to write that date in as well. Are you a resident in New York? Yes or no. Was the specimen collected in New York? Yes or no. On the back of this requisition form are all the instructions. So preparation is, overall you want to make sure you're doing these samples so that they're done on a Tuesday at the latest. So if you mail them Wednesday, they're going to get to the lab by Thursday or Friday. You do not want to mail these to the middle or end of week where they get to the lab on a Saturday and they sit over the weekend. So 3 to 4 days prior to doing the test, you have to avoid the following. And there is a whole list of things you need to avoid. Make sure you're familiar with this. You cannot have any of these: vitamins, minerals, iron supplements, fiber, laxative, antibiotics, antacids, digestive enzymes, antifungals, no enemas or suppositories. Follow this list. Step 1 is the first stool collection on day 1. And what you're going to do is, in order to collect the stool sample, you're going to take some saran wrap and you're going to wrap it around the toilet rim and leave a little bow so it drops down. You're going to put a paper plate or 2 paper plates to be a little more sturdy. You're going to put that on the saran wrap. You're going to squat. You're going to do your stool analysis. Take your stool sample and just take the plate off of that. Do not mix urine and stool. Put the paper plate down, and what you're going to do is start with one of the B vials. The blue solution listed on here is a B vial. The pink solution is the A vial. Take one of the B vials, it does not matter which one. And what you're going to do is take the top off. Make sure you're holding this securely. Do not just leave it down. If this spills, then you'll need another vial. You also don't want this solution contacting your skin. So hold this down, take the cap off. The cap has a little spoon attached to it, a little scooper. You're going to scoop from the stool sample and you're going to put it in here. It takes about 4 or 5 samples or scoops. This is the fluid line, this is the fill line. Once you get to the fill line, do not go above that. So again, top is off, there's a spoon attached, scoop 4 or 5 times till you get up to the fill line. Do not go above that. Then what you can do is you can break off the spoon, throw that away. Put the top on securely. You're going to take this and you're going to shake this for 60 seconds, and then this sample is done and this is going to go in the refrigerator. On the back of this form as well, in the upper right corner, it gives you all these instructions on how to do that. Taking the top off, how to fill it, and then how to shake for 60 seconds after that. So all the instructions are there for the stool analysis. So the next day, and you're also going to put the date collected on here as well. So day 2, the next day, is no testing. You're going to skip a day. So the third day, what you're going to do is take the other, this should be in the refrigerator for those 2 days, take the other B vial and the A vial. You're going to need another stool sample. Wrap the saran wrap over the toilet rim. Put a paper plate or 2 on top of that. Do not mix urine and stool together. And you're going to squat down, have your bowel movement, take the paper plate, put it on top, and again, make sure you're holding this firmly. Do not spill. Cap comes off. You're going to scoop up to the fill line, break off the spoon, throw it away, put the cap on, shake for 60 seconds. Go to the A vial, the pink solution, same thing. Hold this securely. Cap off, scoop. Get the fluid up to the fill line, right there. Break off the spoon, throw it away. Cap goes on nice and tight, shake for 60 seconds, and then both of these will go in the box and they're going to go in the refrigerator. We're also going to be doing a saliva sample with this. These are both going to be done on day 3, the same day you're doing your second B vial and your A vial. And what you're going to do, all the instructions are on here. On the day that you collect, you have to avoid onions, garlic, and caffeine, coffee, tea, chocolate, Coke, and avoid cruciferous vegetables such as cabbage, cauliflower, and broccoli. 60 minutes before each tube saliva test. You have to avoid smoking, eating any kind of food, any beverage except water. Water is the only thing you can have within that hour. Do not brush your teeth, do not floss, do not use mouthwash. You can rinse your mouth with cold water for 30 seconds for about 3 minutes prior to the test. Wait 3 minutes, and then we're going to do the saliva test. We're going to start with the HC vial. The other blue top vial is labeled H. HC, and what you have in here is a cylindrical piece of cotton. Do not touch this with your hands. You might have lotion on there that can affect the test. Take the top off, pop this cotton into your mouth, let it soak under your tongue. Do not chew on it. Let it soak under your tongue for a few minutes. Make sure this gets saturated with saliva. With your mouth, put it back into the bottle. Do not touch it with your fingers. Put the top on, and then this is going to go in the refrigerator. Now, what you're going to do is wait 1 hour, and in 1 hour, again, you're not going to eat any of the foods listed on here. You're not going to have anything except water. And what you're going to do is take the vial marked H, take the top off. This is a little different than the one with the cotton. What you're going to do is take the top off, put your mouth over the top of the tube, and you're going to just work up saliva, spit the saliva into this tube up to the top of the sticker. Once you do that, put the top on, and this too is going to go in the refrigerator. If your mouth is getting dry and you're having trouble working up enough saliva to fill the tube, take a drop of lemon juice, put it on your tongue, and that will help produce some saliva for you. On the bottom here, it says check applicable. Have you used antibiotics in the last 2 years and developed gastrointestinal symptoms? If you have, check that. Also, if you have been diagnosed with gingivitis or if you have bleeding gums, check that. When you are done, make sure this is filled out properly. All the areas on here where it says date collected. Also for the stool on the second day, it says please indicate if your stool was dry, solid, soft, or runny. You have to fill that in. All these things on here are highlighted in yellow, so they're easy to see. Again, make sure you list everything on the front as well. Fold this up. Make sure all these tubes are in this plastic bag. All of these will go in the box. Make sure the requisition form is in the box. Close the box. Write your return name and address right here. Take this adhesive label and you're going to peel that off. Stick that right on the box here. It will seal the box. This is going UPS. So the next day, you just take this out, drop this off at UPS. It's postage paid. You don't have to pay for anything, and you are done. Everything is listed on here. Again, this is Diagnostechs. All the labs are listed on the boxes, the test kits, Diagnostechs. Our summary sheet shows you Diagnostechs, and here's your stool analysis right there.